If you're pregnant and wondering what do babies actually wear in the hospital, then let me break it down. So right after birth, the midwives might pop a knitted hat on them. Sometimes they use the hospital ones, which could be color-coded, or they might ask you to use your own. And then they'll usually be wrapped in a towel or blanket for warmth while you do skin to skin. And once you're ready to get them dressed, most babies will wear a bodysuit and a sleep suit. And if your baby's an average size baby, then newborn clothing usually fits, but bigger babies might need 0 to 1 month or even 0 to 3 months depending how big your baby is. Some hospitals might then put a fresh hat on, but this varies between trusts. If you stay a couple of days and it's really hot, then you might just keep them in a bodysuit. Even with my winter baby, the ward was so warm that during the day he often wore just a bodysuit and scratch mitts. When it comes to dressing them at night, I used a bodysuit and a sleep suit and sometimes used a cellular blanket tucked in. But you can also take a swaddle or a newborn sleep sack if you prefer. But if you are bringing a sleep sack, then I wouldn't go any higher than a 1.5 tog because the wards can be quite warm and you can always add layers underneath if needed. For going home, I dress my baby in a vest and a nice sleep suit, but you can also choose a special going home outfit. If it's warm, then you might want to take a romper with you as an option. If it's cold, then add a cardigan, but you want to avoid thick pram suits or coats in the car seat as this can affect the safety of the straps.